Thank you all for coming tonight. I feel blessed to have an audience that will listen to my story in Costa Rica. As you all know, I was in Costa Rica for a total of 5 weeks. 2.5 weeks in Terambina and 2.5 weeks in the district of San Jose and district of Cartago, serving in a medical mission with other like-minded individuals who are interested in healthcare. These are students from many universities across the nation, from Washington, D.C. to Michigan to Illinois, Nebraska, as well as California. We wanted something that would challenge us not only mentally and physically, but also spiritually, so we see whether we had a passion for medicine. So, I would be lying to you if I told you that I went to Costa Rica and just served 5 weeks at a medical mission, which isn't true at all. I was in Costa Rica because of a research internship that Merit, my philosophy program, was invited to. We were at the Terambina research station where a lot of work needed to be done looking at particular lifestyles of fruit bats and frogs, as well as natural flora that live in the area. As you can see, there's a bat. That's actually a small frog. It's an emerald glass bug. So underneath you can see like intestines and such. It was really cool. And natural flora such as this, I forget the name of the flower, but that's only distinctly in Costa Rica.
That's beautiful.
Paradise.
Yeah. Right.
Yeah.
What is that, a flower?
It's a flower actually. Yeah. I forget the real name.
Looks similar.
Yeah, it's really cool. So we brought our microscope, sorry. Some of our lab equipment out there to learn more of what we don't see stateside. But I told myself I'm not going to go to Costa Rica and on an airline ticket that costs $400 to $500 round trip for just 2.5 weeks. It just wasn't possible. So I thought about a testimony from one of my club officers back in college. I gave a wonderful testimony from ISL. She described how the experience was really enlightening and life-changing, and that living in the United States has sheltered from knowing what is necessary and what is worth living without. So her talk was really awe-inspiring since she wanted to practice medicine in such a community. But I was poor and I could never afford such a trip. Until now, I bring myself over. So, what's on the menu tonight? I know all of you tonight at one point asked me, how's your medical mission? What do you do? What do you learn? Why Costa Rica? But really, if I sat down with you one-on-one, I can share with you an aspect or experience from the trip. But when I go home, I would forget that I wanted to tell you more of what I experienced and what it meant for me to serve. All in all, creating this PowerPoint not only helps me communicate everything, but it helps me remember and cherish all those lives I met, and hopefully a chance to inspire people to go to missions. Organize this mission tonight into these 6 categories. The first 2 is to invite you to learn more about our organization, what they do and will continually do for these countries. The latter 4 stem from my own experiences and perspectives. Where did I see God, how my team and people in Costa Rica touched me. And yeah. This is a little tidbit about International Service Learning, which ISL stands for. It was actually organized by, organization was founded by a reverend who wanted to organize student study tours with meaningful and challenging service components. And they have a whole bunch of missions from Tanzania, Belize, Costa Rica, Dominican Republic, Mexico, Nicaragua, Panama, and Peru. There are a lot of underserved populations out there. And not only do students get a chance to interact with both patient and doctor, but you also learn a little bit of culture within those populations as well. You can also do programs in the areas of health, education, environmental sciences, and community service. The purpose of ISL is providing students and professionals a hands-on opportunity to learn while serving. It provides a significant aid to a very large number of people each year, and quality care time with doctor and students are afforded. Sorry about that. It was a quality learning time with patient and doctor. I kind of repeated there. But we base everything on quality, not quantity. As you know, when you ever go to a doctor's appointment, it's always like 5 minutes, 10 minutes. But in settings like this, we try to make it as long as possible so that the patient can actually have ample time to talk about their lives, what they need from the doctor, how we can actually talk about their life. So, yeah. So my expectations from ISL was actually threefold. I wanted to see practicing medicine in poverty-stricken areas is something I may be interested in the near future. I wanted to know what it's like to be an advocate for underserved communities near and far, finding parallels between their needs and how I can better serve. If I ever get a chance to do medicine, I want to do research on tropical blood parasites such as chagas. Yet the only encounters that I've received have been from textbooks and lecture notes, so I wanted something more. I wanted to be like an asymptomatic patient and observe what it's like to have like debilitating diseases. But really, I also wanted to take it as a job shadowing opportunity to see how doctors interacted with patients and to understand what and why the doctor would ask such questions to patients, why this medicine and not the other. So it was really my ISL trip was really a of discovery, one of learning and discovery, but I can see myself in such situations. What we did at my Mid-Well Commission was mostly house visits and clinics. We would visit the houses on the first day in order for us to schedule a clinic visit for the duration of time we will be staying in and introduce ourselves to the community that we will be serving. We pick a certain population with acute clinical manifestations such as like common cold, cough, flu, urinary tract infections. Then in this manner we also triage and assign degrees of urgency to each of the patients. Like if this person is really too sick, then we want them to come on just today. But if we found someone that was not sick, or he was just getting a minor headache, we would ask them to come the next day or the following day. So, but anybody that has like chronic disease or like diabetes or emphysema and is already being treated for, we don't do anything about that. So house visits allow us to know our prospective patients on a closer level and the conditions in which they live in, as well as the populations that live in the community. We give them a chance for them to tell us what's going on in their lives, and it's the idea of being there to listen. It also allows us to see and see who we will meet and experience everything.
You have an interpreter?
Huh?
You have an interpreter?
Yeah, we have an interpreter. We have people actually can speak Spanish and just talk to us and really tell us what's going on. These are like just locals, people that have been really trained into helping us through these communities. We set up makeshift clinics at these three locations. In Terraces, a small community just outside the capital in San Jose, where a lot of immigrants are from Nicaragua and Panama. We also did a clinic over at Hogares Korea Palace. This is a women's rehab center consisting of the many occupants that suffer from drug trade and sex trade. Our last destination was in a church in Los Piques called Clínica Church Nuevo Salvador, Los Piques. And a lot of them come, because this place is really well known, a lot of the community members just go here, and we chose this spot as like the main spot for a lot of the people to come. So we spent almost 3-4 days at each location respectively, and I admit, Los Piques, the last location, was one that hit me hard most. This is from the data we collected at the communities. Our mentors gave us a chance to deduce the culture that we are serving and we will be serving. We see an incredible difference in the age of childbearing. By 22-24, around the median age of our medical mission group, we were told that it's common to see adults with 2.5 to 3 children. At the level of education, it's mostly many of the individuals drop out of secondary school because they either didn't want to, or they're forced by their parents or elderly to just help out with family. and earn their keep early. At the clinics, we see many of the patients are children or elderly and young mothers. We not see any males, since it's the role of male to be out all day or even out all night to earn money for the family. If the woman does work, she does what she knows best, being a housemaid. And that's a whole culture of what it's like being in these communities. Most of the nationality at the Tarasis and Los Iques clinics, we see a high influx of Nicaraguans who are not permitted to get any health coverage whatsoever and are shunned from the community because they're status as an immigrant. Many Costa Ricans believe that they're freeloaders and they don't deserve to be there, even though Nicaraguans leave because of the present state of Nicaragua, and they earn a lot more in Costa Rica than they do in Nicaragua. Social Security and health insurance, many can afford to pay that $35 minimum fee, and it's just really hard to see how their living conditions and such. And for city potable water, they usually withdraw the water from a water tower and bring it to their house for washing their clothes and wash their dishes, whatever they have to do, they use city potable water. And you will never know what's in there or if it's contaminated or anything. They just go and buy every day and just bring it to the house, from long treks all the way to the house. And sometimes it's 2 miles away, so they.
You skipped the toilets.
Huh?
Latrine.
Oh yeah, toilets in the. I forgot to say that. Yeah, they have. Yeah, sorry about that. They do have toilets and covers. So it's in these communities they had it, but in other areas, such as in Panama and Nicaragua, they might not.
Are you talking about flushable toilets?
Yeah, flushable toilets.
Oh, okay.
Yeah, and they have a sewer system there. Yeah. Hogares Reapadas. This is a women's rehabilitation facility for underserved individuals. These are women that are chosen through socio-economic status and severity of their addiction. If you're probably wondering, what does it mean, Hogares Reapadas? And it means that we believe in mothers with children, where the love between the mother and child is one of the strongest bonds that can break hold of any addiction to drugs. I mean, it runs really true into this facility, since many of the mothers that I have talked to, they use this relationship as their willpower to become stronger and to lose their addiction to alcohol, drugs, or whatnot. I mean, they also don't want to ruin the lives of the next generation, and they're willing to change for the better.
Are these single women or mixture?
Some of them, it's a mixture. Because they marry at such a young age, or they get into relationships even with 13, 14. It's just phenomenal. I mean, the women here did not choose to fall this far, but because of pressures from money, pressures from the parents, and pressures from society itself, they lose a sense of themselves, and they have a chance to use this facility to make a change for the better. This is an example where people use a lack of privileges to become a better person. Like in the United States, we have privileges so that we can become better in socioeconomically, like we can get a better education and such. But I guess people belie their strength from adversity. The facility itself has a lot of Catholic relics and many places of worship, where the kids use this as a place for sanctuary, and mothers have a chance to pray. There's a nunnery across the street, and there's a huge church 2 blocks down. Later on, you'll see from the slideshow, I have a whole bunch of pictures.
Alvin, what does that mean, the name?
Oh, Hogar Create Mothers. Oh, it means that we believe in mothers with children. Like we believe in creating homes and stuff. So let's jump to where did I see God? On the first day of training, we were introduced to Bible verse from the book of Proverbs, chapter 3, verses 27. Do not withhold good from those to whom it is due, when it is in your power to do it. And the Bible verse helps us to reverberate why we are out here, that you are holding out a helping hand to those that come for it. And how I interpreted it was to hold an open heart to those that needed it, and their spirit is shunned away for those that come to you. But because the majority of the group was of other religious affiliations, such as Hindi, or even non-denominational, such as atheists, our mentors used stories mainly to teach. It would be like a cycle of story in the morning and reflection at the end of the day. We would use these stories as a way to soak everything up that we see during the day. And just reflect on it, let's share with each other what was going on in our minds, what we experienced and such. And there are two stories that I wanted to share with you, and I thought were really helpful with me throughout my time at the medical mission. The first one was about two farmers with a donkey who traveled the mountainside. One day Jehovah came to them and said, "Pick up as many rocks as you will tonight. In the morning, you will be happy and sad at the same time." So the two farmers listened and picked up rocks that night and carried them back to their home. In the morning, as they woke, they were amazed that the rocks had become diamonds, emeralds, and precious stones that you could think of. But at the same time, they were sad that they did not pick more when it was the opportune time to do so. I equated myself as the farmer in the story, where the patients were the precious stones. Each patient is different. Some walk hours away from their home to receive treatment at our clinic. Some take almost a half a day, since they are indigenous persons from a tribe that is secluded from the urban environment. Some are exactly your age, but because of circumstances they cannot control, they share with you what it's like to be in their shoes. Had to see what each of these patients were unique and important with my walk with God. I mean, at the end of the day, we were able to see many patients, but the sad part was that we could not see them all. That the patients that promised to come had chosen not to come to take up the offer, but we just had to close. The second story is a German bomb, given to us at the women's rehabilitation facility. I felt that this story impacted me the most throughout the entire trip. Back in World War II, Britain was being bombed by German Nazis. Every night, there would be a bomb raid on different cities, from London to small villages. After every bomb raid, there would be a bomb squad scouring damage and looking for undetonated bombs. But there was one bomb in particular that had fallen onto a school in London. As the bomb squad inspected the bomb, they went through every single crevice. They saw the reason why the bomb didn't detonate was because the detonator was not installed. Instead, there was a note attached to the bomb that said, "I'm a Jewish prisoner working at death camp, and this is what I can do." Later on that day, at the women's rehab facility, the head cook came out, and she had been there for 7 years suffering as an alcoholic, and said in Spanish, "Thank you for your help. Here's one of our famous foods that everyone enjoys here, and we hope you enjoy it well. We cannot reciprocate what you have done for us, but this is what I can do." As always, food is always better when it's made with passion and love. But really, what I saw God was those same words from both my mentor and the head cook had said that morning and afternoon. I mean, okay. No, really though. I mean, of course, these stories I had shared with you had great meaning, and it would be nice to end it at that. But halfway through my mission, I remember that question: where did I see God? I guess it's in my nature to just dive deeper. I would say that the two people that I saw God were from Mr. Edwin Pietras and Mr. Andres Villalobos, depicted from the pictures above and below. We all know that society is based on culture of the population. On a more mathematical proponent, if society equals culture, then changing culture equals to changing society. So when he's not working for ISL, he put that idea into action. He formed a community center called La Roca, or Rock in English, nearby in order to inspire children to stay in school, and uses scripture in order to teach new morals to teach children. The children and teenagers have stayed longer in school, and even inspired many of them to get advanced degrees, not only in bachelor's, but in medicine as well. The center has provided change to unserved from near, but also he has inspired individuals like me to be an advocate as well. The second person, Andres Villalobos, I mean, just do it, is based on his own motto. I really admire Mr. Villalobos, but where I see God in him was his perniciousness, his determination for running. He runs marathons, gets up 4 in the morning to run 10 miles each day. When I came to peel myself off my limit. But he has already given up he's already up with his running shoes. Like everyone wants breakfast, he's like, he comes back and he's like, I don't really need that much breakfast, and I just ran. So I asked him, where do you get your inspiration from? He tells me, I do it from my mother, my father, my wife, and my children. His mother died of a sudden cardiac arrest when he was 25, when he was struggling with alcohol and depression, and uses his love for his mother as his inspiration to change stuff from within. Okay, so, but what do you learn? If you pick up a chance card in the game Monopoly, there will be a card that tells you to go to jail, do not pass go, do not collect 200. This sort of society is in Costa Rica similar. In Costa Rica, the education works in tandem with the workforce, similar to that of the United States. You go from primary school to secondary school to public university. Any points where you quit, you can never go back. There isn't a community college like that in Costa Rica where you can change career paths. And once you drop out for good. Edwin's testimony to us was this: I really wish I was your age, but at an ample age of 19 or 20, where I had the possibility of going to medical school. But I told Edwin, but you're 25, you can still change. You can still change your career. But he replied back, it doesn't work that way here. I just feel privileged to be in the United States where there's more mobility, where we have the ability to change careers in the middle of our lives. There's a lot more upward mobility as well. No matter where you're from, you always have a chance to be anything you want to be. Privileges is a word that really resonated from my time in Costa Rica. Did it meet my expectations? Going back to the earlier side, is medicine right for me? Yes, it would be, but I just had to work harder. What is it like to see manifestations of debilitating diseases? A little bit disappointed here, but I can't always see. It was hit and miss here and there, but instances of malaria and bloodborne pathogens just wasn't present in our place, so I didn't get a chance to do research on that. Another one was to learn more about doctor-patient relationship. Definitely, we picked up a lot of brains. There was a moment where one of our group members had to walk outside because the doctor suggested that the patient's parents throw away the bed, the blankets, and the clothes of the child because the child had head lice and body lice, which is what you're supposed to do. But in their circumstances, they can't just throw away the blanket. They can't just throw away the bed. And to be an advocate for underserved communities, personally, I'm still struggling with this one. Though I still volunteer at the Children's Hospital in the neonatal department, I still give bedside tutoring to the kids there. I don't know how to be an advocate for the patients that I meet in Costa Rica. I know that I will never see them again or have a chance to write to them or see how they are. By giving this presentation, a moment where I can share with you my experience with these patients, I walk with God in Costa Rica, this is what I can do for now. And that's pretty much it.
Why did you say they had to walk with the patient outside?
No, meaning what I said earlier.
Just studies.
About the lights.
Oh, like one of my group members, because she was just so flustered. It's like, why do you have to tell them to take everything and throw it away? It's not right, And she had to walk out and actually think about it before going back in, because she just doesn't really agree with the doctor of his suggestion to what that patient needs to do.
Who's she?
Huh?
Who is she?
She was just one of the other medical mission people.
Like someone that
Like me.
volunteered.
Like me.
So how did they resolve that? The family?
What happened was one of our mentors, like Andres, he said, just take the bed, wash everything really hot water, and just try to keep everything clean as much as possible. And we did give him a shampoo, like a head lice shampoo and everything. We have everything, all those treatments and everything, but the real thing is if you have blankets and clothing that had with head lice, then you had to
So,
Infestation, yeah.
It's
Eggs,
supposed to
Mhm.
just fall.
live in a hot
My
tub.
brother got lice and we didn't have to guard it.
But there's different circumstances.
There's
So
head
like you live in the United States, you have actually more materials and such to help you with that.
Disinfectants. so-
But if you see my video later on, you will see that a lot of the living situations or conditions, they're not up to par to the United States. So therefore,
They probably multiplied so much already.
Yeah, it's probably their only bed and only blanket and only pillow.
Yeah.
yes.
Or they kind of question Western medicine, or I know they have their own type of medicine too, right? Your own type of medicine.
Oh yeah,
Besides-
we did have that. We used some herbal remedies and such, which are a lot cheaper and a lot better than giving like penicillin and such. But at the same time, they would rather when they come to one of our clinic, they expect something in return, like they will have something sort of like a Robitussin or such and such. But it's just so hard for them to actually afford such medication. But of course, herbal remedies is just as good. But they just want something like concrete.
So who supports this?
Various donors and vendors. We had a lot of our group members. We keep donating a lot of medication to them, and it's just like a lot of sponsors and stuff. Stateside that they can't go to these medical missions, that they support it through material means.
The patients want Western medicine over herbal remedy?
No, it's not a matter of what they want. They want herbal remedies over medication, like what we give them. But it's more like if you go to a doctor's visit, you expect like, I have a prescription of something, so they'll help me out. So we didn't want to let them go empty-handed. That's sort of like that aspect to it. Like if you go to a doctor's appointment, like you would want a prescription for for your own sickness, right? So we kind of provide them that. Can we move on to the slide here? Yeah, we're going.
Let's see the slide, yeah.
Actually,
So what was the main disease anyway in that area besides malaria?
we weren't in malaria infested areas, but a lot of it was mostly UTIs, urinary tract infections. We also had a lot of in women they don't get that many pap smears, so they have a lot of infestations now in the menstrual area. And a lot of it was also I saw a couple cases of epilepsy where seizures and such, but he was on medication already, but it wasn't enough medication for him. So yeah.
Were these clinics free to the people?
Yeah, they were free to them. We just go up during the house visits. We would go and introduce ourselves to the community and say, we're here for you. Please come to your clinic if you need some help. We give like tickets based on the severity. So this one says 8/4, come on this day. We'll be here for you.
This is not new to them, this is something ongoing?
This is ongoing, yes.
Yeah.
So basically you guys go out in the field and triage everything.
Change of personnel.
Yeah, we triage everything. We see who needs the most help. Come right now or come
Yeah.
later. So yeah.
Where did you get the epilepsy medicine?
No, everything's donated to us.
You had medicine or everything?
No. What do you mean the epileptic? Like the person with epilepsy?
Yeah.
That person was already given. He has a chronic manifestation, so we sort of avoid like giving them all other medication if it's. Do you get it? We just provide patients with acute manifestations, meaning that if they get a flu, if they suddenly come down with a sudden cold, we give them medication for that.
So you did nothing?
But anything that has chronic, like epilepsy or like diabetes, if they have insulin already, like if they have epileptic medication, we don't touch that. We just treat whatever they're sick at that moment.
I think you said you didn't have enough medication.
What do you mean by?
The epileptic, you needed more medication.
I don't remember.
Yeah, you said something like it wasn't enough to control.
Looks like he probably forgot to take his med.
Because he still had a seizure, right?
Yeah, he still has seizures and such, but we don't want to mess with that illness because he's already being treated for it.
Yeah, he's being.
So we don't want
So
to.
there's like a hospital further down the city or town?
Well, it's like 8 hours,
8 hours.
9 hours a day. So they go far just to treat their own health, but sometimes it's just not logistical.
So how far away do you guys go?
We try to go, on Los Piques, we drove all the way to another area, like 2 miles away, to talk to people too, so they come to our clinic, so we can treat them. But for Terrasses, we kind of just went like a couple blocks down, a couple blocks down this way. And
Is this a Christian-based organization? So
it is.
It's non-denominational. There's no expectation.
The people that I was with, a lot of them were non-denominational, or like Hindu. But I mean, I'm a Christian, so.
I mean,
but
is there expectations for preaching to the patients or to the people that go there, or it's just basically just because they're doing God's work and that's the main purpose?
Sorry, repeat your
No,
question.
I mean, in other words, like, some organizations before they feed them, they preach the gospel to them. I'm saying, is this one strictly where you're just supplementing medical help for people that can't afford it?
Yeah.
There's no expectation for them to
Yeah.
have to receive,
I'm pretty sure they actually receive a lot of spiritual guidance. Because a lot of our clinics are based from, it's a Christian-based organization, so they have people that already go there and preach them to them. And one of our locations is actually inside clinic locations is actually inside a church.
Oh, okay.
So we have a lot of connections with the reverends and we talk to them. Can we use this place for clinics? And they would be able to, and it's like an ongoing relationship with everybody. So. And that's how we really get our location set, is from talking to people that actually are in need. With the women's rehabilitation facility, they would need, because they don't qualify for medical care, healthcare, they would call us up, we would go to them, and we'd give them like a year-round checkup, what problems were happening, So yeah.
You should have gone to Africa if you wanted to study bloodborne diseases.
Yeah, probably.
Jeez.
Next time, huh?
Yeah, next time.
Next time.
Air Force.
Let me put this on.
Okay,
Yes.
more questions? Or?
Sure, lots of questions.
Did you get to like tell us some of the stuff? Did you get to administer shots?
We practiced it, yes.
Oh.
We got it. We learned a little bit like phlebotomy 101, just a little
okay.
bit. But we never really had a chance to actually use it because a lot of them because we weren't working in a hospital.
Okay.
A lot of IV fluids and such we couldn't give them because after that clinic visit they just go straight back home. So we can't just get them, here's the IV bag.
Right.
So,
How much medical training did you have before you went?
I trained as an EMT at college. I licensed everything, but I can't give out any.
And is that is there like a requirement?
No,
for
no. I mean, there are people that are pre-nurse. They have a lot of nursing experience, so they bring it to here. I mean, of course, I come from neonatal, so I have a lot of baby holding experience. So each person has like a certain set of qualities that actually they bring to it. So.
Alvin, what was your word about taking pictures of women? That was interesting. What did you say?
It was just for their own safety because we didn't want the rehab facility to be raided by like slumlords and stuff. So we didn't take pictures we didn't take pictures of them, and because there was a chance of getting uploaded to the internet, then from the internet they were able to track them down somehow. So they told us specifically, oh, don't take that many pictures. If there's pictures of the girls or the ladies, don't put it in your Facebook or don't put it into anything. Which is kind of weird because I've been living in the States. But
You're just following directions. Yeah.
I mean, I'm just following directions. I mean, I'm just respecting their wishes.
What's the most interesting case that you saw?
Actually, probably the epilepsy one. And there's one where there's this guy with a huge cyst on his back, and he had to get it removed somehow, but we couldn't remove it. So we told him, hey, here's some medication for you to rub on you. If it gets itchy, you can use this, but you can go to a hospital and get it treated. We don't if the doctor had the tools to actually remove it, he could, but he doesn't have X-rays or anything of that sort to actually look at what blood vessels might be colluding in that area. So we didn't go into cutting it out. So.
When you go on the house visits, it's a doctor with you?
No, it's just us.
Just
a medical mission with our mentors.
So how do you diagnose what's the problem? You just basically talk to them and you just kind of...
We get it based on the patient medical history, sort of like, oh, do you have any allergies? When was the last time you got hospitalized? If you have say you have stomach aches, do you ask just questions pertinent to it? And
did they have a rap sheet or did you just talk, ask them? I'm just curious. I mean, because there's no malpractice situation, so if you make a mistake...
There's no malpractice or anything in Costa Rica, so they're not really worried about that being sued and anything. But I can understand where you're coming from. Like, how do we talk to them? Do we ask the interpreter to ask them questions? But we had I'm kind of fluent in Spanish, so I'm able to ask a lot of questions to them. A lot of our other members, they had a rap sheet of, does it hurt here? Where does it hurt? How long have you had this problem? And it will be all spelled out. Also, on the very first day, we had a training session where we would be able to practice on medical Spanish with each other. So, yeah.
But I mean, when you were going house visits, you weren't actually treating patients.
No, they're doing a survey. Right. Like that's how I was able to get all those the age, when they are married, how many people are living there, or So we had a big discussion of this is how it is here. Like what is it like over in the States side? Do you see people getting very 15, having a child already, like 2 So.
Were the homes mostly excited to see you, or were there some homes that were don't?
A lot of them were guarded, of course, but a lot of them were like, oh, come in, I would like to talk to you. And a lot of them were really, really nice. But I could understand from their side of the videos, why we let some strangers come in and actually
So
talk
how
to
often did you actually pass the threshold, or other kinds of doorstep?
7% of the time. Costa Ricans are really, they're really open. There's one point where I was stuck. I couldn't, meaning, I had a day, it ended on the 16th, right? But I left on the 18th. So what I do in that one night stand, one of the mentors actually said, "Oh, come to my house, just sleep over a bit." I mean, I lived like 2 miles away from the airport. I was driving in the morning. Don't worry about it. And I was able to stay there. I mean, regularly we would be like, "Oh, just go to a hotel," but we're not susceptible to it. So I left on 18th.
So what you do the other weeks then? You said you were there.
Oh, I was-
5 weeks.
Yeah, but I said that I was over at the Turbina research station, so I took a lot of pictures. I did a lot of research on bats and flora. So that's why the second. Okay, it's okay. You saw pictures of like bats and like.
That's frogs.
Yeah, so we did a lot of research in that area. I mean, if you want, I can show you more pictures of what I did over there. But yeah.
Were they like surprised that you came in, you're Asian, but you speak Spanish? Were they surprised?
Oh yeah, yeah. Because I had Spanish ex-girlfriends.
Friends.
No, I said girlfriends. So I was able to speak a lot of Spanish and everything. So yeah, I was able to do that. So yeah. And I also took it.
Smooth moves in Spanish.
No.
I know they all have a common siding for slum house, corrugated metal, galvanized.
Oh yeah.
Very common in Russia, China, same thing,
Yeah.
everywhere.
It's cheap materials. I mean, it's makeshift materials. Just put it up. You can make a wall. You can use for rain and everything. But
They're super noisy, though, haven't
Oh, yeah.
Yeah.
Super noisy.
Yeah.
But the facility looked like they were very clean and,
Yeah, it's state run actually.
they're what, state run?
State run.
Huh.
But they don't get, a lot of them don't get medical insurance based on the fact that they are from underserved populations. There's no Nicaraguans in there whatsoever, or like Panamans, because of the fact that they are out of the country. So Costa Rica has like a really, really strict policy of if you live here and you're a citizen in Costa Rica, you get free healthcare. But
But
that
the
also has
Nicaraguans don't get healthcare.
no,
They can't go
because
to.
it's sort of like us, our relationship with Mexico. Like we don't want. Well, I would want Mexicans to have healthcare here. Like they get health insurance here, but at the same time they can't because they're
So could
not
somebody
really citizens.
pretend that they weren't Nicaraguan and come to the clinic?
They get it free.
Yeah, that's why they get free. Well, meaning what do you mean by
No.
that?
So you
Sorry.
don't treat Nicaraguans? You don't-
We do treat.
Oh, you do treat the Nicaraguans? Okay,
At the clinics we do. We
At the
treat everybody
clinics you
that
do.
needs it.
Okay.
But like if you go to a hospital, if those Nicaraguans go to like a hospital and such, they're not able to get treatment. Unless they pay a good ample sum of money, you know, like, oh, here $400 US, treat me, and they'll do it. But it's all about like money for that. Like when I was at Tirambina research station, I had a sudden case of eye infection, and it was all red, puffy. I couldn't see in one eye, but I didn't have health insurance whatsoever. But once I went to the doctor, he said, "Oh, just give me $50, and I'll treat you, give you medicine." The medicine was pretty expensive too, it was like $30. So it's like $80
Out of pocket.
50 out of pocket. And they told me, okay, you'll be fine in a couple days. If you just get better, come back to me in 3 days, 4 days. I'm like, I'll come back to you. $50? No. Yeah.
You should have said I didn't have
You
that.
said about, go to a hotel, that's all you got to say.
Oh, like there's a night, because you see, August 16th, I left on August 18th. There's a night in which I couldn't go anywhere because the place I was staying for the duration of the medical mission, I can't stay there anymore because another medical mission is coming in to use that house. So what am I to do? I mean, I'm stuck. If I stay at a hotel, I'll have to pay for a hotel night stay. Then I'll have to pay for the shuttle to and from the airport. You know, it's just more money for me. But then one of my mentors, he said, "Oh, don't worry about it. Just stay at my place. We live close anyways." And so you sort of see that Costa Rican hospitality there. Like they're guarded sometimes, but they're not really guarded sometimes. They would welcome you in their house. That's sort of like their culture, sort of thing.
So the culture I know is the piñatas, huh?
Yeah,
That's
well,
all in the picture.
yeah, everyone, I mean, I went to my friend's grandma's birthday party last week, and she's Mexican, and she would have piñata and do kids hitting it. I mean, I think everybody should have piñata. I mean, candy falling all over the place, it's really fun.
So Alvin, what do you think was one of your greatest learnings from this trip? And do you think that it has changed you?
I think it's changed me in a lot of ways. Like I know that sometimes like when you see on TV, oh, I want that new car, or I want that new iPod, or that new iPhone, or I need a new laptop. I mean, I have all these things already, but like, do I really need it though? Do I really need it to sustain my whole life? I've sort of cut back on a lot of things, like, oh, I don't need a breakfast every day at Starbucks, I don't need that coffee. I can brew my own, I can make my own food, you know, like I've become more, I guess, more self-aware of what I'm doing. And yeah, I think it's changed me a good amount. I mean, I don't know if you guys see it, but you know, I try, I mean, I just do my best with what I have, you know, so. I mean, I just know that what's more important to me. I don't know if that sort of answers the question.
Sure.
But,
do you think you would do another trip similar to this?
Oh yeah, definitely. If I can save up more, yeah, I would. Yeah.
So your cell phone working in a room?
No, it did not work.
Not at all.
No, I didn't even bring my cell phone because I didn't know people that well. I only brought my laptop only because I needed it for my internship, not because I needed to do data analysis and everything. But that was it. Like, yeah.
But at the clinic, you're able to get Wi-Fi or you can.
At the clinic, there's no Wi-Fi whatsoever. They don't have internet access.
Huh.
So we're completely
Cut off
from the world, which is nice too. Like you don't really need that chatter. I don't need Twitter, kind of like hitting me or like Facebook.
So do people use the mosquito nets?
For our medical mission, we didn't, but I wish we did.
Oh.
Not because like, oh, I wanted mosquito, but I wanted to be more in that sort of environment where I need a mosquito net.
Oh.
I want to be there, so because in those situations, I would see more, and I would be able to meet a lot more.
Okay, next trip, Africa.
We can help sponsor you.
If you want malaria.
I took malaria pills before I went in there, but no.
Was that suggested that you do that?
No.
No,
It's just for my own safety.
You just gotta go.
Did you hallucinate?
No.
So, this trip, okay, so you had to pay for your transportation there.
I paid everything.
What else did you pay for?
Paid for food. Part of the food I had to pay for. Those scrubs, only brought one set of scrubs. Because I watched them every night. They told me, oh, you're supposed to bring 3 sets of scrubs. I was like, oh,
3 sets.
I did not know that. I thought it said scrubs. So what I did was it was really, really hot there. So all I did was just take scrubs, one set of scrubs, wash them every day. I mean, the only thing you see me wear that's different is the color of the shirt, the other shirt.
Right.
So because I washed everything because it was really humid and sweaty. So I washed everything. We had a dryer over there. We dried everything, or I hung dried it. So I mean, I didn't want to. I mean, I'm not going to spend like $30, $40, $50 on scrubs. So yeah.
So if you're like seriously ill, they didn't provide you any medical assistance if you were seriously ill?
When
If you got more than just your eye infection.
I mean, we have the doctor right next to us. So.
Yeah, somebody there got really sick.
Okay, then why didn't you go see the doctor about your eye? Why did you go to the...
Well, that was
before I said.
That was before.
That was the time he was working in the clinic.
Oh.
Yeah.
He got the infection while he was at the research station.
Yeah.
Oh, I see.
I mean, I was allergic to everything. And I didn't know. I didn't even know that we weren't supposed to drink the water.
Oh.
And so that first week that I was there, I just wasn't feeling too well. And my friend that was rooming with me, I was just like, oh my god, what's wrong? You gotta use the restroom again? I'm like, yeah, thanks. But
Ochai pills?
There was no orientation there.
no, for a research station, I didn't even know anything. I just came and said, oh, I can come in. I'm strong enough. You know, I can take in everything. You know, but at the same time, I kind of got sick, but I kind of got over it because I said, okay, what would I do if I was in the States? Eat more berries, eat more antioxidants to actually get everything out.
Cilantro.
So I had natural remedies over there. I guess.
That was,
Yeah.
it was in the soup and the.
Huh? Cilantro, yeah, they use a lot
Supposed to be
in
help.
their foods.
For some reason.
Yeah, they had running water, but you just don't know, like, whether it's chlorinated enough.
Brown water.
Wow.